Hello, this is Dr. Gary Degrasse from Baptist Health Primary Care. I will talk about heart disease prevention. In the USA and most developed countries, cardiovascular disease are the leading cause of death in men and women. When we talk about cardiovascular disease, we are talking about coronary artery disease, we are talking about myocardial infarction, stroke, and peripheral vascular disease. This is a heart that looks exhausted. He has to do hard work every day. So our job is to try to maintain his health. So we have to do preventive medicine every day. We should do changes in our lifestyle, as we discussed in a sec. In the United States, since 1975, cardiovascular disease has declined approximately 25%. Nearly half of this decline is due to early diagnosis and aggressive treatment, and remaining half of decline is due to changes in lifestyle. This means diet, exercise, and stop smoking. DNA is not a destiny, it's a tendency. So approximately 20% will go with our DNA, but 80% of heart disease is preventable with all these lifestyle changes as diet, exercises, and stop smoking. So the power to have a healthy heart is in our hands. There's a prospective study, the Framingham Health Study, that tried to look for risk factors to cardiovascular disease. And they found the first one was cigarette smoking. Then they found high cholesterol and hypertension. After that, they found lack of physical activity and obesity. And also they find that physical factors like stress and anxiety also can lead to cardiovascular disease. About 500,000 Americans die each year related to smoking. 90% of these people, they start to smoke as a teenager. 5 million deaths each year in the world. So cigarette smoking remains the leading avoidable cause of premature death. The more we smoke, the more probability of having disease from cardiovascular origin and also mortality related to this. If we stop smoking, the benefit will start a few months after we stop smoking, and we'll reach a peak the same as the people who never smoked at 5 years. Then cholesterol control. So we can see here a diet, not exactly what we have to eat, but otherwise we have to avoid this food. We have to avoid the hamburgers, the hot dogs, the fat food, as cheese, salami, red meats, French fries. And we should eat, as here we show, whole grains, vegetables, fruits. Also drink plenty of water and try to avoid red meats and fats. The best heart-healthy foods are strawberry, blueberry, spinach, oatmeal, and fish as salmon. Here we can see an ideal plate that includes grains, vegetables, and fruits. Then we have to manage our blood pressure Recently, the American Heart Association came with guidelines that decreased the diagnosis for blood pressure from 140/90 to 130/80. So this doesn't mean that we have to start to give medication early, but we need to do the lifestyle changes, meaning diet, low salt in the early stages. So aggressively lowering the blood pressure would save more than 100,000 lives in the United States each year, according to prediction data from the SPRINT trial. So on this, they based the new guideline for hypertension. So what we have to do is to do a healthy diet. It was described some time ago is the DASH diet. So it includes vegetable, fruit, grains, nuts, avoiding fats and red meats, and try also to decrease the salt in our diet. Also, we have to exercise. That will help to decrease the cholesterol, and we have to control our blood pressure. It's recommended to exercise at least 3 times a week, ideally 5 times a week, 30 to 45 minutes. Here we have the American Heart Association Life Simple 7 Steps. We talked about this, but it's the most important, probably more important than the medication. So first, we need to get active. As we talked before, we have to control the cholesterol with changes in our diet and follow the medication that prescribed our physician if it's needed. So eat better, vegetable, fruits, exercise. Then we have to manage our blood pressure, and we have to lose weight. Also, reducing the blood sugar will help us to prevent cardiovascular disease. And last but not least, smoking. We have to stop. Probably is the most important cause for cardiovascular disease. Thank you very much.